is Tuesday, May 4. This is the news on PBCJ. I'm Simone Absalom Gale. Another COVID-19 vaccine has been given the green light by the World Health Organization. The WHO has listed Moderna for emergency use against the virus. This is the fifth vaccine to be given the nod by the organization. Director of the WHO, Dr. Tedros Ghebreyesus, made the announcement at a latest COVID-19 press brief. According to the WHO, the objective is to make medicines, vaccines, and diagnostics available as rapidly as possible to address the emergency, while adhering to stringent criteria of safety and efficacy.
Emergency use listing is one prerequisite for vaccines to be purchased and supplied through COVAX. It also allows countries to expedite their own regulatory approval and to import and administer a vaccine.
Dr. Ghebreyesus says Gavi has signed an agreement with Moderna to provide 500 million doses under the COVAX facility. He says a deal has also been made with Sweden to acquire AstraZeneca vaccines from their supplies. Sweden's donation follows that of France and Norway.
This morning, I met with Sweden's Minister for Development Coordination, Minister Per Olsson Frid, who informed me that Sweden will donate 1 million doses of AstraZeneca vaccines to COVAX.
The WHO boss is calling on other countries to follow suit so as to accelerate equitable distribution and access of COVID-19 vaccines.
COVAX has now shipped almost 50 million doses of vaccine to 121 countries and economies. But we continue to face severe supply constraints. Solving this dilemma demands courageous leadership from the world's largest economies. Next month, leaders from the G7 countries will gather for what may be the most significant meeting in its history. The G7 countries are the world's economic and political leaders. They're also home to many of the world's vaccine producers. We will only solve the vaccine crisis with the leadership of these countries.
He says COVAX has a funding gap of $19 billion, and the funds are needed to help vaccinate most adults around the world. Time now for a look at the latest COVID-19 clinical summary.
In the summary for Monday, May 3, 48 new cases of COVID-19 were confirmed, as well as 3 new deaths. The island's overall case count is now 46,087, of which 23,307 are active cases. Also, the death toll has now climbed to 793. The new cases were taken from a test sample size of 1,221. The parish breakdown is as follows. St. James reported 9 cases, Kingston and St. Andrew 8, and Manchester 6. Clarendon, St. Thomas and Westmoreland all had 5 cases each, while Portland, St. Catherine and Trelawney had 3. Hanover had 1 case, and there were no reported cases in the other parishes. On the recovery side, 159 were posted in the last 24 hours, bringing that tally to 21,646. At this time, there are 218 persons in hospital, with 18 patients moderately ill and 26 said to be critical. Melvin Pennant, PBCJ News.
The Office of Utilities Regulations, OUR, says the country's 2 major utility companies are reporting declines in breaches of the guaranteed standards for the 2020 October to December quarter. In a statement, the OUR says JPS's compliance report on its guaranteed standards performance indicated that 16,952 breaches were committed during the quarter. The OUR says JPS breaches attracted compensatory payments of approximately $37.1 million. On the other hand, the National Water Commission's Guaranteed Standards Compliance Report indicates that 504 breaches were committed during the 2020 October to December period. Leslie Harrow has quit as Office of Disaster Preparedness and Emergency Management Head. He demits office after he was appointed 6 months ago. Mr. Harrow submitted his resignation last Friday with immediate effect. He was appointed last year by Local Government and Rural Development Minister Desmond McKenzie on November 1. Ministry of Finance and Public Service has addressed the issue of uncollected care grant monies. Gabriel Thompson explores this story plus other market details in this business report.
$300 million of the $14 billion approved for payment to applicants of the COVID-19 Allocation of Resources for Employees Care Program remains uncollected. The Ministry of Finance and the Public Service says uncollected funds relate to the Set Cash Grant, General Grant, and Compassionate Grant. On Friday, the ministry indicated plans to publish the names of persons with uncollected funds, but on Monday said this would no longer be done. Included in the uncollected grants are grants dispersed to remittance agencies at the request of applicants. Beneficiaries are asked to note that regardless of which remittance agency they selected, the uncollected grant can at this time only be collected from LASCO MoneyGram agencies. Some of the uncollected grants are from applicants who selected deposit to a bank account. If the selected bank is unable to confirm the details provided by the applicant or the account has been reported as dormant, the Finance Ministry has redirected these payments to LASCO MoneyGram. These beneficiaries were advised of this change via SMS or email. Approved beneficiaries who have not yet collected their grants are asked to do so at LASCO MoneyGram agencies by May 30, 2021. After May 30, any amounts remaining uncollected will be returned to the Consolidated Fund to ensure compliance with Jamaica's laws and regulations. Beneficiaries are required to provide their Care Reference Number, TRN, and valid government-issued ID to collect grants at LASCO MoneyGram agencies. The Finance Ministry says further details will appear in newspapers on Friday, May 7 and Sunday, May 9. The ministry says that since its inception in April 2020, the CARE program has successfully disbursed over $17 billion to over 500,000 Jamaicans. Persons requiring additional information may call CARE Customer Support at 888-493-2273. In Monday's trading session, the JSE Combined Index declined by 9,662 points to close at just under 400,000 units. Overall market activity resulted from trading in 96 stocks, of which 50 advanced, 32 declined, and 14 traded firm. The Junior Market Index advanced by 57 points to close at over 3,000 units. Stocks advanced for Access Financial Services Limited, AMG Packaging and Paper Company Limited, and Burrito Investments Limited. Stocks declined for 138 Students Living Jamaica Variable Preference, 1834 Investments Limited, and CAC 2000 9.5% preference shares. Trading firm were 138 Student Living Jamaica Limited, Caribbean Assurance Brokers Limited, and Dolphin Cove Limited. Sagicor Select Funds Limited Financial was the volume leader with 12.5 million units, followed by Wigton Wind Farm Limited Ordinary Shares with 6.4 million units, and Caribbean Cement Company Limited with over 3.5 million units. In foreign exchange trading for Monday, May 3, the US dollar sold for an average $153.92. The Canadian dollar ended trading at $127.47. The pound sterling traded for $216.57, and the euro sold for an average $190.21. Oil rose more than 1% on Monday as Chinese economic figures and U.S. vaccination rates pointed to a strong rebound in demand in the world's two largest economies. Investors remain wary, however, over record-breaking infection rates in India, the third largest fuel importer worldwide, along with higher OPEC Plus oil supply. The United States and China, the world's two top oil consumers, are expected to drive a recovery in demand from the coronavirus pandemic. Brent crude futures rose 80 cents to $67.56 a barrel. West Texas Intermediate crude futures rose 91 cents to $64.49 a barrel. And that does it for this Tuesday edition of the Business Report Inside the News on PBCJ. I'm Gabriel Thompson. Pleasant viewing.
In regional news, we look to Barbados. The COVID-19 outbreaks at the psychiatric hospital and the Queen Elizabeth Hospital are reportedly under control. Word of this came from the island's Health and Wellness Minister. Barbados Today has the details.
Last week, 15 of the 17 new COVID-19 cases involved patients and staff at the mental health institution, and 3 other persons tested positive yesterday. Minister Bostic said health authorities are working to contain the situation, and an isolation center has been established on the hospital's compound.
The situation at the psychiatric hospital internally is under some measure of control, and I say some measure because we still have to await the second test. But from the first test, we are satisfied that we've been able to do a level of containment that is necessary. And what we are working on right now, especially, is to be able to complete that process within the psychiatric hospital and also tighten up on all of the loose ends in relation to outpatients who we are contacting and trying to trace to make sure that we could wrestle this problem to the ground.
Director of the psychiatric hospital, David Leacock, revealed that all 82 clients and 25 staff members on the affected ward have been tested. He said the outbreak has not affected the hospital's day-to-day operations.
Prior to the actual outbreak, we had already reduced visitation to the hospital, so that's not been impacted. Operations, otherwise, as far as services, have not been severely impacted. We still continue to give care at all levels. Our outpatients clinic remains open, and our community service continue to function as normal. As we said, we have been supported by the Ministry of Health, whether it's QEH or the polyclinics or district hospitals, as far as staffing is concerned, to ensure that we can give care internally uninterrupted at this point in time.
In giving an update on the QEH, which was the source of an outbreak last month, Minister Bostic said no further positive cases had been recorded.
The situation really is a result of some positives amongst members of the QEH security staff, both private as well as public. And what we have seen is that a number of those persons have been able to return to work having tested negative on their second test. There'll be no further positives coming out of that particular situation. And we believe that as soon as we are able to complete all of the second tests for everyone associated with that, if it continues on its current trajectory, that we would be in a position to close off that case. But at the moment, things are looking good. As I said, some members have returned to work, and we hope that that will continue over the next few days.
At the current rate of COVID-19 infections in Trinidad and Tobago, the country can soon maximize the capacity of the parallel health system in 7 to 10 days. The concern was raised by medical professionals during a media conference held by Prime Minister Dr. Keith Rowley. More details in this report.
It's almost a year and a half since this country has been battling the COVID-19 pandemic, and for the first time since then, medical professionals are expressing concern about the rapid rate of infection among the population as opposed to the capacity of the parallel healthcare system. Epidemiologist attached to the Ministry of Health, Dr. Avery Hines, during the Prime Minister's press conference, shared what he deemed concerning statistics. He said if the daily COVID-19 infection rate remains or even increases, the situation is likely to get worse.
The more active cases you have, the more hospitalized people you have. Both of them trend upward in the same direction. Let's project that forward. At the current rate of speed, looking at the active cases, we are on track to have alarming numbers of active cases by May 22nd.
So what does this mean for the hospital capacity?
That dotted blue line that we see is the hospitalized people being projected going forward. The red horizontal line is where our maximum hospital capacity is at this moment. And you note that they will intersect. They actually cross each other. The dotted blue line goes past the red line. And that can happen within as few as 7 days and as many as maybe 10.
Meanwhile, the Ministry of Health's Principal Medical Officer, Dr. Mariam Abdul-Richards, said an average of 14 out of every 100 COVID-19 positive cases requires hospitalization. She added the number of persons being admitted daily far exceeds the number of persons being discharged from hospital.
The length of time that a person or COVID positive patient is in the hospital may vary anywhere between 3 to 5 days for a less ill patient to up to 10, 12, and in some cases 21 days. So I'm just trying to highlight how long a patient may be in a hospital bed. It's not a simple turnaround in terms of time.
Health officials also said a new trend in terms of COVID-19 related deaths has been noted. It appears more women are succumbing to the virus, and those persons also fall into the 29 to 49 age group. Crystal Wilson, TTT News.
Do not come out if you don't have to, and do not congregate if you do come out. That was the stern warning given by Trinidad and Tobago's Prime Minister, Dr. Keith Rowley, on Monday, before announcing further restrictions to curb the spread of COVID-19. Added to the restrictions effective tonight, midnight, is the discontinuation of all food services, including street food. Kimberly D'Souza has more.
I have absolutely no qualms in doing what has to be done to protect the lives of the people of Trinidad and Tobago.
Prime Minister Dr. Keith Rowley is assuring the public he will do all that is necessary to prevent the loss of life. His commitment to what he must came during Monday's COVID-19 health update held at the Diplomatic Center in St. Anne's. Among the Prime Minister's decisions, further restrictions to public gatherings.
As of midnight tonight, all food service will be discontinued, and that includes itinerant or what you call street food selling. All.
While Dr. Rowley notes there will be inconveniences, he says he was certain people can feed themselves at home until May 23. He admits he did not anticipate the level of convenience that some were afforded when restaurants were closed last week Thursday. The additional restrictions also affect businesses in the retail sector.
All retail would be discontinued for a specific period of time, the details of which will come to you by morning. And that's non-essential retail. We will still keep the essentials going.
Some of the essential businesses include groceries, pharmacies, hardware stores, financial services, and others, which Dr. Rowley says will be announced in further detail on Tuesday. However, food supply stores and pharmacies will now operate between 6 a.m. to 8 p.m. Dr. Rowley left the public with one stern warning.
And we are saying to the population again, for the days ahead as described, if you don't have to come out as an essential worker or don't have to come out for essential business, stay at home, stay away from people.
If we do this, Dr. Rowley says we can minimize the chances of being infected with the virus, and we can also decrease the country's infection rate. Kimberly D'Souza, TTT News.
In sports, we take to the track. Jamaica's Elaine Thompson-Herah ran a season's best 10.78 seconds to win the women's 100 meters final at the Pure Athletics Sprint Elite Meet held at the Claremont track in Central Florida on Sunday. This was a season's best from Thompson-Herah and the second fastest time in the world so far. In the men's 100 meters, Johan Blake grabbed second in the men's 100 meters in a wind-aided 10.02 seconds, at the same time credited to Antigone Shehe Green, and both men also running the same times in the prelims, a wind-aided 9.98 seconds. And that's the news. Thanks so much for watching PBCJ. Remember, we are the People's Station.